Hello friends, welcome you all to the lower back pain series episode 2 in the lumbar disc herniation. This is the condition most commonly encountered, most commonly discussed, most common problem in our society. As we know, lumbar back pain or low back pain is a third most common condition after diabetes and hypertension for which we visit hospital to seek help. And in the lower back pain, lumbar disc herniation, we called sciatica, disc bulge, slip disc is a most common condition. So we will know what is lumbar disc herniation. Myself, Dr. Shomir Bosak, interventional pain physician, and this is a vertebral body, and in between the vertebral body there is a gel-like structure, and this gel-like structure act as a shock absorber. As if we bear in heavy load, then this act as a shock absorber in our vertebral system. If this shock absorber got damaged, then what happened? This is looks like inside nucleus soft gel-like structure, nucleus and outside annulus fibrosus, outside fiber-like structure. If we see closely, this is inside gel-like structure, outside fibrous donut-like structure, donut. In disc is protected inside the vertebral column by so many ligament, backward interspinous ligament, anteriorly anterior longitudinal ligament, posterior longitudinal ligament, posteriorly backward is ligamentum flavum. So with the so many ligamentum structure, bone structure, how a disc can slip. So slip disc is a misnomer. We should rather use the term disc herniation. With this disc herniation, what happens to our body? There is the nerve got compressed, nerve got irritated, chemical and mechanical problem in the nerve. So this is for this reason lower back pain, limb pain, limb numbness, radicular pain, all these symptoms occur. We called sciatica. There are few terms, mainly three conditions like disc protrusion. When disc is gel-like structure is protruded from the inner side to the outside in the fiber-like structure, this is called disc protrusion. When gel-like structure come out from the fibrous structure, this is called disc extrusion. When this gel-like structure got separated from original site, this is called disc sequestration. This is more serious problem, is called more pain, but it is more interesting fact we come to later on. This is in asymptomatic, this is in all the person in our society. If we done MRI, if we do any MRI, what we can see? We can see that there is disc degeneration, disc herniation almost 37% patient in 20-year age group, and it increased 88% at 60 year, and at 80 year almost 96% somewhat disc herniation is present. So for all patient we don't treat, and for all patient no need of any surgery. So disc herniation is a natural process like our gray hair. Disc herniation treatment is required only when there is some medical problem, medical emergency arise. This is the broader spectrum view how disc herniation compress the nerve structure. There are few risk factors in our life, day-to-day life, environmental, biopsychosocial method. We have to assess that what are the risk factors. First risk factor is age. With increasing age, we have seen that chance of disc herniation is more. With obesity, chance of disc herniation is more. With increasing high axial load like from workplace, it is more. With smoking cigarette, it is a risk factor, one of the risk factor. But interesting fact is, our natural process, this herniated disc got resolved. This is spontaneous resorption of herniated lumbar disc. So when our natural process is like this, why we need treatment, why we need surgery? This is one MRI picture, T2 MRI. We have seen that in 2012 and 2013, disc bulge at the L45 is resolved in 2013. So why we should do treatment? Treatment is required for symptom. If there is pain, limited activity, we should treat this. And incidence of spontaneous resorption from one important meta-analysis, this is evidence-based study, so that 66% condition among the Japanese population and almost 80% in European population, disc herniated disc got resolved. It is more resolved when there is more disc bulge, and extruded disc got more easily resolved. So extruded disc more pain but easily resolved. If we can heal the pain, we can treat the pain, then this there is no need for any operative surgical treatment. Difference, and there is study among the conservative treatment and surgery. What they have seen that British Medical Journal, they have seen among this study that surgical treatment only provide faster relief, like your back pain got healed, back pain symptom uh, resolved in 4 weeks, whereas in conservative treatment it takes 6 weeks. This is only result from surgery, and it carries surgery associated with higher morbidity and higher cost, and improve more suffering, and improve your quality of life is hamper with surgery. So since lumbar disc herniation has a favorable natural history, why we need surgery and neuroimaging up to 6 weeks? Don't do this type of imaging and surgery. Wait 6 weeks, got treatment conservatively. If there is any red flag, then you should be aware. When pain is not relieved by rest, when pain is not changed despite 4 weeks of treatment, when pain is associated with visceral abdominal from arise from abdomen, when there is cancer, when there is fever, when there is fracture, it is more common in osteoporosis, older age, when there is weight loss, fatigue, weakness, when there is gradually um, progressing motor and sensory loss, this is neurological impairment, your limb got weak progressively, you cannot hold your bladder bowel function, this is bladder bowel dysfunction. In this condition is red flag and surgery is required. Only 5% case this condition happen, otherwise 95% case this is the conservative treatment. What we do, we should know our disease and we should behave in that way. If in flexion our pain is more, we should limit our flexion. If load, high axial load with weight bearing, if our pain, we should limit weight bearing. So education and ergonomic instruction is more important. Then comes cognitive behavior therapy. If in sitting, your after prolonged sitting, 30 minutes sitting, your pain arise, you limit your sitting to less than 30 minutes, 20 minutes, 25 minutes. If any work your pain is increased, so limit that work time less. Next comes some medication, non-steroidal drug, you know diclofenac, you know aceclofenac. Next come muscle relaxant, Myorel, then come baclofen, then co-analgesic, pregabalin, amitriptyline. All this medication prescribed only by the doctors. Then comes physical therapy, depending upon the stage of the disease. Acute stage, we should do passive exercise, graded exercise. In 6 to 12 week, we should do direction specific, like some flexion, like some extension, backward, forward bending exercise. Isometric exercise required during that period. and low load exercise is required. And with all the exercise, we will come next episode about the type of exercise and type of other conservative treatment. So do something, do some exercise, it is better than doing nothing. Next come interventional pain physician. Those treat pain, chronic pain, spine pain like us. We can help you to get rid of any pain. When this initial conservative treatment is not helpful, we can do epidural steroid injection. There are varieties of approach, and these are very safe and no side effect at all. This is not oral steroid. Like intervention, transforaminal, lumbar, transforaminal sacral, caudal epidural, adhesivolysis, neuroplasty. If in rare condition, we have to seek help for pulse radiofrequency dorsal root ganglion. Next come minimal invasive surgery. We are also, as we know the approach, there are percutaneous endoscopic lumbar decompression, percutaneous endoscopic lumbar disc decompression, interlaminar approach, transforaminal approach, and with expertise, we are interventional pain physician also doing this minimal invasive surgery. So if surgery required only 5 to 10% patient, then also you do minimal invasive surgery, not open surgery, and you will do faster recovery. Interventional pain management, it is a growing field and upcoming field. You will know that this is the transforaminal lumbar injection, only one needle approach, and your pain got healed, you will recover. Then your disc material, those is extruded, protruded, sequestrated inside your vertebral column, it will got healed and your symptom got relieved. So with your back pain, do proper diagnosis, then you do any treatment. Surgery, it is the last resort, and it is associated with loss of morbidity, more complication, and you may end up some serious complication. So this is a 2020 year back pain, global year of back pain, and September pain awareness month. Feel free to call us any low back pain related problem, and we are here to solve your back pain related problem. Feel free to share the video and like my channel and subscribe my channel. Thank you. I'll come to the next episode with some another topic. Thank you. Bye bye.